There's been a lot of talk around the world about Sweden's different approach to tackle the coronavirus. I'm going to try to sort things out a little and explain what's really going on. One of the main talking points has been Sweden's efforts of retrieving flock immunity. With flock immunity meaning that so many people have been infected by the virus that the virus can't find any new people to infect. Roughly speaking, that's how it works. Depending on what kind of virus we're talking about, the percentage of the so-called flock that needs to be infected to retrieve flock immunity differs. Since corona is a new thing, we can't know for sure when flock immunity would be reached. But looking at different numbers, a guess could be around 60-70% of the population. However, the notion that Sweden's approach and strategy to fight COVID-19 is to try and reach flock immunity is not true. I'm going to try and explain where that notion came from. The communication between the government and the media has mostly been taken care of by our state epidemiologist Anders Tegnell from the Institute of Communicable Disease. He's supposed to be the one responsible for our COVID-19 strategy. Let's take a look at some of his and the government statement. On January 24th, he says, quote, "There's no reason to worry about getting infected by the coronavirus." End of quote. On the 28th of February, Prime Minister Stefan Löfven says, quote, "Our preparation to handle a larger outbreak is good." End of quote. It's not hard to draw a couple of conclusions from those two statements. Number one, our state epidemiologists seem to have very little clue as to what was going to happen with the coronavirus in Sweden. Second thing is that the Prime Minister most definitely was blatantly lying, as we were definitely not prepared for a major pandemic. Fact is, it was not even a secret that the government did not believe that we needed to prepare for a major pandemic. 3 years earlier, the Minister for Energy and Digital Development, Anders Ygeman, is quoted saying this, quote, "Forget repositories with food, protective masks, and other supplies. A modern defense shouldn't build on structures from years past." End of quote. In 2015, in a publication, the Institute for Communicable Disease says, quote, "Sooner or later the world will be hit by another pandemic, and this could be serious." End of quote. Just a year before that publication, 7 million protective masks were burned and never replaced. The government knew we weren't prepared for a pandemic, were warned, but didn't care, and obviously lied when they said we were well prepared. The hospitals and nursing homes have been crying out for face masks and other supplies they have needed. There's also a lack in oxygen. This lack has costed a lot of human lives. So back to the idea that many people believe Sweden is looking for flock immunity. Our chief epidemiologist has never said that is what we were looking for. He has only said that as a concept, it's great. A conscious plan to reach flock immunity would cause huge numbers of lives, as Great Britain found out after initially adopting that strategy. So what is it that Sweden is really trying to do? It seems that if there is a real strategy, it's somewhere in between searching for flock immunity and trying to apply social distancing, but without going into a complete lockdown, thus having infected people but not too many at the same time, so we would overflood the hospitals. So how has it gone so far? Well, we need to understand one thing at first, and that is that no country can really know how well their corona response has worked until the epidemic is over, because we don't really know how it reacts. Those countries that has done very well so far may be hit later on, so we can't really know. But if we look at the situation with corona deaths like a football game, where we would be competing against other countries for the smallest amount of lost lives. Sweden is trailing most countries by a lot right now. But in any game, it's not over until it's over. But Donald Trump was definitely right when he said, quote, Sweden is doing very badly right now, end of quote. When we look at deaths per capita, we are right now at 363 deaths per million inhabitants. The US is at 276. Spain is at 593. So we're far from doing the worst. However, compared to our closest neighbors, Denmark 93, Finland 52, Norway 44. And that's the league we should be playing in. It's looking quite devastating. So what is the cost behind these dismal corona numbers coming out of Sweden? Slow to react. Like I mentioned earlier, on January 24th, Anders Tegnell from the Institute of Communicable Disease didn't think that COVID-19 was coming to Sweden. And I suppose it can be okay to have that opinion. But what is not okay, and what in the end I'm sure will have proven to cost a lot of lives in vain, is to not take measures for an imminent breakout of COVID-19. That meant letting planes from heavily struck in corona areas continue to bring infected passengers long after other countries had already closed their air travel. That put Sweden off to a really bad start. Other countries like Norway, for example, went into lockdown fast. And well, it's plain to see that that has obviously worked. The worst and most embarrassing fact may be Sweden's complete failure in protecting its elderly population, though. COVID-19 has been running rampant in nursing homes. This is something that didn't have to happen. There are definitely measures that could have been taken to prevent this if there had been a serious effort and if we had been better prepared. Testimonies from staff in nursing home tells a story about lack of oxygen, proper face masks, and supposedly new healthy old people are even being put in the same rooms as deceased corona patients. Instead of oxygen, morphine is being given as relief, which by some doctors is considered euthanasia. Here's what one staffer had to say, quote, how can Sweden just leave old people to die in this way? That has built our welfare. Not even a hospital or oxygen. Just pump them full of morphine and wait. How the hell can they stand on national TV and say that protecting our elders and weak ones is a priority when things look like this? End of quote. Because that's the thing. Our government has talked about that from the very beginning. How important it is to protect those groups. I really wish I didn't have to write these things, but I really feel compelled to do it because of the way things are going and our government's efforts of putting on a face in front of the rest of the world like we know exactly what we're doing and things are going according to plan. We were not prepared. We don't know where we're going. Things are not looking good. We have not taken care of our old ones in a way that they have deserved. My prayers and admiration goes out especially to those brave warriors, men and women here in Sweden, that are fighting to save lives, even though they have not been given the best possible conditions to do just that. They are trying so hard to do. Save lives.